Hi, my name is Dani Ondreka. I am a community outreach fitness specialist with Kettering Health Network, and today we're going to look at neck and upper back pain, some tools you can use for prevention in your everyday life. So, where does neck pain come from? For most people, it's going to come from poor posture, especially while sitting. So every day as we're sitting at our desk, possibly working, we allow ourselves to slouch forward, to look down, our head to fall forward. We're going to start to feel some pain. We can also see pain in the neck through arthritis, which is generally genetic, stress, and that and muscle tightness definitely go together. Any sort of injury or chronic condition, maybe you've experienced a car accident, whiplash, you have some other sort of genetic condition or a disc malfunction. But majority of the time, poor posture is going to be the culprit. If left untreated, we can actually experience some pretty serious symptoms, the most common of which are going to be headaches. Headaches can most often occur when we have tightness in the muscles that are surrounding our neck. So if we are feeling a lot of stress, or we do have a lot of weakness in our upper back or our shoulders to keep us upright, again, looking at poor posture, we can experience headaches. Jaw pain and tension are also very, very commonly experienced when we do have headaches. And as always, anytime we have exacerbated curvatures in the spine, we see here this gentleman coming forward, we can experience nerve compression, those nerves that kind of travel through in between our spinal discs. Limited neck mobility. With his curvature here, you can see it's probably going to be hard for him to turn his head from left to right and to take it up and down, and spinal kyphosis. So this is this extreme curvature we see in his upper back, at the back of his shoulders, that little hump-like structure there. All right, so let's look at the anatomy of the spine just a little bit more, just so we can fully understand what's happening here. So when we sit with poor posture, we can see here this spine, there's some excessive curves that probably should not be there. It is placing undue pressure on other portions of the spine, primarily our discs that sit in between our vertebrae and our nerves, which you can see are running right there in between those little root-like structures. When we have pressure that isn't even from side to side or from forward and back, we can create pressure on one side of the disc, which eventually, as we lose collagen and elastin as we age, as we gain weight, we can start to see how those discs can start to grind together on one side or the other. We can also experience nerve compression in the exact same way. We can experience narrowing of that channel that those nerves travel up through, and as those discs begin to shrink as we grow older, those vertebrae just come slamming together, which can also compress those nerve roots, causing a significant amount of pain. Let's look at some cervical spine stretches next. So these 4 muscle groups that you see listed pretty much comprise most of the muscles that surround your neck, all of which can become tight when we have poor posture or pain. So if we look at the very bottom, the suboccipitals are where we're going to start. They're actually the very base of your skull. So we're just going to take that head all the way down, let gravity release it, interlace those fingers at the back of the skull, and a breath out to relax. There is some ability to come from side to side here if we're feeling on the outsides of the bottom of that skull a little more pain. Now, if we just move the head directly to the side here, we're going to start to get some more upper trap and some levator scapulae, which help to lift and lower your shoulder here. So I'm just applying slight pressure with my hand. As I take a breath out, I'm releasing my elbow and allowing the weight of it to stretch me instead of pressing as hard as I can into the side of my head. Now, continuing on with this roll, we're going to open all the way out to the side here. My ear is pointed up towards the ceiling. Still getting a little bit of levator there. And as we continue on with that roll, opening the face up towards the ceiling, I get a little more scalene here in the front. So starting all the way down, we just opened all the way up here. Beautiful. And you can move between those positions, or feel free to stop in any particular one that feels better to you, any place that you are feeling pain. Looking at some back extensions, this is a great one to do with the back of a chair. So let's back right up to the very back of our chest, so our back is flush with it. We're going to take our hands to the back of the head here. Just take a big breath in, open the chest, and lean back, giving your spine some space. We take a breath out to release. Big breath in, open the chest, extend that back. Obviously not to the point of any pain. We don't want to make anything you might be feeling worse, but we do want to find some movement there in that upper spine. Next, we're going to look at windmill reachbacks. We're going to start with your hands in a prayer position directly in front of you. All we're going to do is just gently slide one hand back, reaching back behind us. Now you can reach as far back as you'd like to. however feels comfortable to you, just getting some movement in that upper spine. Making sure we absolutely do both sides about 8 to 10 times. Last, we're going to look at a corner or doorway chest stretch, which normally would be done within a doorway or in a corner. We're going to stretch out these pec muscles here in the front that tend to become compressed or tightened as these shoulders come forward when we have poor posture. So you're going to take both of your hands out to the side just like this. If you have a doorway that you can press them into, that's even better. I don't here, which is okay. I'm just going to focus on pushing my elbows back as if I did have a door frame. So gentle pressure forward with those hands. We're going to act like we're leaning forward here, allowing those elbows to come back, stretching out these muscles here in the front. You can come forward and back as many times as you need to. The nice thing about having a corner or a door frame is you really have a space to hold your weight, so you don't have to worry as much about that. But I can still find a nice stretch here. We can also stretch and mobilize with some tools. So if you have a small ball available to you, like a tennis ball or a lacrosse ball, you can essentially have your own self-guided massage. So any place that you're feeling like your muscles might be really tight or knotted, you might have a trigger point that needs to be released, you can take a ball and you can roll it on a wall or on the floor. A wall is really, really nice because you can control the amount of pressure that you place into whatever tool you're using. So if I'm trying to work on my upper back or my spine, I'm simply going to place this ball in between me and the wall. I'm going to push back into it as hard as I feel comfortable. Now I can stay on just one point that really, really hurts or doesn't feel so nice and just breathe. That breath out, helping my muscles to relax, to help the ball to get where it needs to go. Or I can kind of roll and I can move around. So there's that little massage we're kind of talking about. The most important thing is that we don't place this ball directly on top of our spine. We generally don't need any more compression there. So staying away from the spine anywhere else is fair game. All right, once we are finished stretching, we want to make sure we're nice and loose, right? We have no tension that's left. So do a couple quick neck rolls, just like we started with in the beginning. It's also really nice to take an ear from side to side. We're kind of checking and seeing if there's any tension left there. And it's also really, really great rule of thumb to shake that head yes a few times and to also shake it no. All right, now let's look at a few strengthening exercises. So stretching is great, but we don't want to put a Band-Aid on a problem and never fix the root cause. So if we strengthen these muscles that are weak from falling forward from poor posture, we can get rid of some of that pain. So first, let's look at a chin tuck. When we do this motion of tucking the chin, we move the chin straight back, not letting that head fall forward and down. That's already our problem generally. So if we would like to use 2 fingers to help us, we're just going to press back very, very gently. You're almost going to think about making yourself a little double chin. Helps to strengthen these muscles in the front of the neck that often become weak when we allow the head to fall forward. 8 to 10 times is a good rule of thumb, making sure that that face and that jaw stay in the same plane. Second, still looking at the jaw, we have protraction and retraction. All that means is that your jaw is moving forward and your jaw is moving back. So to protract that jaw, we're going to allow it to move forward. Imagine your bottom set of teeth moving out past your front set of teeth. Good. And in the same way, we can also retract that lower jaw. So imagining this lower portion of your teeth moving back. Probably feels like a pretty strange motion, but can also relieve some jaw pain there, which is great. Next, we're going to look at some scapular retraction. So just as with your jaw, that retraction was moving back, scapular retraction is going to be moving your shoulder blades back, which strengthening those muscles helps with posture, absolutely. So there are a couple different ways we can do this. We can look at low, middle, and wide. When we're pulling low, we're going to keep these elbows really close to our sides, really tight to our sides. We're going to pull these arms back in a single plane, squeezing our shoulder blades together and down. So from the side, I'm pulling straight back. I'm opening my chest, giving a little squeeze and maybe a hold here at the bottom of that position, and then allowing them to move back forward. As we come middle, we can allow these arms to come a little bit higher. There's a difference here between letting my shoulders come super high and compressing my neck and letting them just rest comfortably. So we pull back in the same exact way, pulling our shoulder blades back and down, squeezing tight, maybe a little hold here at the end of that position. As we come wide, We can fly our arms out till they're parallel with the floor. Same motion, we're gonna pull straight back, squeezing those shoulder blades together, hold for just a moment, and then allow them to come back forward. These motions are done with your back and with your shoulders. Take care to take a breath out and relax your neck muscles as you do that pull so that we're not creating any more tension here than we already have. Wall slides are another great exercise to turn on your lats, which run right up underneath your shoulder blades. If you have a wall to lean back against, awesome. If you don't, that's okay too. You're gonna imagine making a W with your arms. We're gonna open the chest. If there is a wall behind you, you are aiming to touch the wall at all times as best you can. We're gonna pull these elbows down towards your sides and squeeze on top of your rib cage, imagining our shoulder blades pulling down our back, all right? We're creating a little crunch here in the side of our body, pulling and squeezing. Beautiful. The more we keep that chest open and push out, the more you're gonna turn on the correct musculature there. These last two, we're gonna do a seated bent over fly. Now this could be done a couple ways. If you have some weights at home that you wanted to use to do an actual fly, or you had a water bottle there at your desk, you could absolutely do that. If you don't have any of those things, that's okay too. We're gonna bring our hands to the back of the head. We're gonna bend over from the waist, keeping the spine nice and straight. We're simply gonna lift up like a Superman and then relax straight back down. So I'm squeezing my shoulder blades together, I'm opening my chest, and then I'm relaxing forward. Push that chest out and then allow it to curl. Beautiful. Last one we have here is a straight arm push down, also aimed at targeting your lat muscles. Very, very important in your posture. Keeping those arms straight, all we're gonna do is pull straight down towards our side. And we're squeezing those exact same muscles that we used on that wall slide. Right up underneath your shoulder blade, pushing straight down and squeezing. Beautiful. So obviously, the most important things to do is to practice proper spinal alignment and good posture. That is one of the best ways to negate pain in your neck and upper back. So in order to practice while sitting or standing, take a big breath in. Imagine your spine being pulled up by a string directly through the top of your head. You are a puppet, and you can feel that that spine initially just feels longer immediately as soon as you take that breath in. Allow those shoulders to come back and down as you breathe out. You've already realigned your upper spine. We do want to make sure we are grounded through our feet, or if we are sitting, through our sits bones. They are the bones that you feel immediately when you sit down. They are taking your weight. So we want to make sure that weight is balanced from one side to the other, but also forward and back. Also practice stacking your spine. So if you can imagine your body coming forward, maybe you're hunched, we've just kind of had a day, we're working really hard. As you take that breath in, imagine stacking each piece of your spine one piece at a time, starting from the bottom, moving all the way to the top. A couple things you can also work on throughout the day. We do have a natural curve in our lower back that sometimes can feel uncomfortable if we're sitting in a very uncomfortable chair, something that doesn't have a lot of lumbar support. So if you need to use a small towel, a cushion, a small pillow while you're sitting, that might also help you with upper back pain throughout the day. Be really, really aware of where you are looking. If we are constantly looking down at a phone, a book, we tend to let gravity take over and pull our body forward. So be very aware of trying to keep things within your line of sight. Also, taking breaks is a great time to take a couple breaths, realign that spine, maybe get up and move. If we stay forward in one position, we tend to stay there for a long period of time, and then it's harder to get back out of it. So set an alarm, write a note for yourself, maybe every hour, to take that breath in, to align that spine, to get rid of that pain. Thank you for joining us for this presentation on neck and upper back pain. We hope that these tools are helpful for you in your day-to-day life on decreasing your pain and helping to increase good posture. Keep your head up and have a good rest of your day.